The GrayDuck Dart is an easy-to-fit commercial stent device that offers customized placement of a patient's tongue away from the radiation field during head and neck treatment. The GrayDuck Dart is a new and improved version of the original GrayDuck stent, offering a significantly smaller and easier-to-use stent while retaining the same level of customization. By choosing to use the GrayDuck Dart, you'll save your patient and clinic added time and expense they'd otherwise spend having a custom stent formed while still providing protection to your patient's tongue, taste buds, and salivary glands during radiotherapy. The device is intended to be used by or under the direction of a licensed physician for repeatable positioning and immobilization of the tongue and jaw. Patient education is important when using oral stents. Patients who tolerate the device well understand that head and neck radiation treatment will be challenging. They desire to cooperate with the treatment plan and want to protect their oral structures if informed of the benefit. To help achieve patient adherence and motivation, include the patient in the fitting process from the beginning. The GrayDuck Dart comes in one universal size. During fitting, the GrayDuck Dart requires a bite opening of at least 20 millimeters, or 3/4 of an inch between top and bottom front teeth. A bite opening of 25 millimeters, or 1 inch, is required when one spacer is added to the arch tray. A bite opening of 30 millimeters, or 1 3/16 inch, is required when 2 spacers are added to the arch tray. A patient should have at least a few lower teeth to anchor the stent and allow the stent to be repositioned between treatments in the same position. For many patients, having their tongue touched is uncomfortable and can induce a gag reflex that slows the fitting of the stent. With time and practice, patients will overcome these reactions to the stent in their mouth. Begin by speaking with the patient about the pros and cons of using the GrayDuck Dart. If the patient feels rushed during this discussion, it could slow the overall fitting process and device acceptance. The goal of using the device is that the stent will place the jaw, teeth, and tongue in the same reproducible position from the first treatment session to the last treatment session. Explain to the patient the benefits of tissue sparing, reduction of mucosal ulceration and pain, taste bud preservation, and salivary gland function. This explanation only takes a few minutes for the patient to realize the benefits and improve overall compliance during treatment. Explain the fitting process and how the patient will be positioned during treatment. Talk about the stabilizing paddle of the GrayDuck Dart that will touch the patient's tongue. Discuss the forward tongue thrust position that's achieved by resting the tongue forward when wearing the device during treatment. Inform the patient that the tongue position should be comfortable and repeatable. Explain that the device can feel warm or even hot on their lips before being placed in their mouth after stent insert material is softened in hot water. Typically, patients tolerate the heated material well, which cools rapidly to form a dental impression. The GrayDuck Dart has a default arch tray opening of 20 millimeters, which is sufficient for most patients. If a wider bite opening is required, 1 or 2 spacers can be used to add 5 millimeters or 10 millimeters respectively. If an additional 5 millimeter bite opening is required, remove stent insert and add 1 spacer to either top or bottom of arch tray. Then add the stent insert on top of the spacer. If an additional 10 millimeter bite opening is required, remove stent insert and add 1 spacer to both top and bottom arch trays. Then add the stent inserts to both sides of the arch trays. Heat the GrayDuck Dart stent insert by placing it in recently boiled water added to the device container for 2 minutes. Doing so will soften the bite material to create a dental impression. A bowl or mug can also work well. Remove the stent from the hot water and absorb any excess water with a paper towel before placing it in the patient's mouth. If your preference is to use an oven to soften the bite material, preheat the oven to 80 degrees Celsius or 175 degrees Fahrenheit and heat the arch tray for 6 minutes. The GrayDuck Dart is universal, so it can be placed into the patient's mouth on either arch tray side. Position the stent along the top teeth with the anterior wing nut screw under the nose. Instruct the patient to bite firmly into the heated material and hold the bite for 15 seconds. Remove the stent from their mouth and carefully rinse with cold water to set the indexing impression. If the indexing impression is poorly formed or malformed, you may place the stent back in recently boiled water or an oven and retry. Have the patient place the formed GrayDuck dart in their own mouth and position their teeth to the indexed dental impression. Once the dental impression has been set, it's time to attach and secure either the depressing or sideways paddle. The goal of the GrayDuck dart is to protect oral tissue from fields of radiation without being too aggressive, which might make the device intolerable to wear as treatment sessions progress. Insert the depressing paddle into the central anterior port of the arch tray. Align the paddle position by sliding it back or forward or rotating it to achieve the desired position. Secure, but do not over-tighten the initial positioning of the paddle by turning the anterior wing nut clockwise before placing it in the patient's mouth for evaluation. Over-tightening the wing nut at this stage will make it difficult to untighten if further adjustments to paddle position are required. Ask the patient to put the stent in their mouth, then have the patient move their tongue to a forward position. Press the stent against the lower teeth and ask the patient to open their mouth. This will allow you to check the positioning of the paddle. Lock the paddle position by further turning the anterior wing nut clockwise until you can no longer tighten it. This will keep the paddle in the desired position without risk of loosening or slipping. As you tighten the wing nut, you will hear clicking sounds indicating the paddle is locking. Once locked, handheld pliers might be necessary to unlock the nut if further paddle adjustments are required. Ask the patient to put the stent in their mouth. Then have the patient move their tongue to a forward position. Press the stent against the lower teeth and ask the patient to open their mouth. This will allow you to check the positioning of the paddle. Insert the sideways paddle into the central anterior port of the arch tray. Align the paddle position by sliding it back or forward or rotating it to achieve the desired position. Secure the initial positioning of the sideways paddle position by tightening the anterior wing nut. Secure, but do not over-tighten, the initial positioning of the paddle by turning the anterior wing nut clockwise before placing in patient's mouth for evaluation. Insert the positioned device into the patient's mouth and press the device against the lower teeth and ask the patient to open their mouth. This will allow you to check the positioning of the paddle. Over-tightening the wing nut at this stage will make it difficult to untighten if further adjustments to paddle position are required. Lock the paddle position by further turning the anterior wing nut clockwise until you can no longer tighten it. This will keep the paddle in the desired position without risk of loosening or slipping. As you tighten the wing nut, you will hear clicking sounds indicating the paddle is locking. Once locked, handheld pliers might be necessary to unlock the nut if further paddle adjustments are required. It's important to dedicate time for the patient to practice wearing the device in the treatment position, which can enhance the patient's acceptance of the device. With time and practice, any potential gag reflex can be overcome. For more challenging cases, you may consider having the patient take the fitted device home to practice and establish if it will be tolerable during treatment. GrayDuck dart can be used with many types of thermoplastic masks. With the stent placed in the patient's mouth, pull the thermoplastic mask over the stent and patient's face. To create a secure coupling, ensure the mask is crimped and molded around the exposed wings of the wing nut. Doing so will ensure an inseparable coupling of the device to the mask. If coupling of the stent and mask is not desired, use an open face mask and ensure the pulled mask is not in contact with the GrayDuck dart, so it can be separated for cleaning and storage afterwards. After each radiation treatment, thoroughly clean the device. Remove visual contaminants with a common germicidal or antiseptic wipe, such as a Cavi wipe or hydrogen peroxide wipe. Thoroughly rinse the device with tap water for 30 seconds and air dry before storing the mask and stent according to your facility's standards. Refer to your facility's standard cleaning protocol as well. For additional information, please contact your local CQ medical representative or visit us at www.cqmedical.com.